A growing number of children are being diagnosed with neurological disorders. The statistics are astounding. 8 to 14% of children under 5 years old are identified with a developmental delay. 1 in 100 children are diagnosed with some form of autism. 120,000 children annually are diagnosed with childhood epilepsy. 600,000 children annually suffer a traumatic brain injury.
Neurological disorders in children is a growing problem. For example, there are more and more head injuries per year, and in fact, traumatic brain injury is the leading cause of death and disability in children, more than all other diseases combined. Neuro-oncology, pediatric brain tumors, is the leading cause of death in children with cancer. Epilepsy, one of the leading neurological disorders affecting 2 to 3 million children in our country at any given time.
It takes multiple medical professionals to care for patients that suffer from complex and interrelated neurological and behavioral conditions. In fact, it's widely acknowledged among the medical community that collaborating to treat these special patients enhances their care and improves their outcome.
If our goal is to improve the quality of these kids, to improve their outcomes, you truly need a multidisciplinary approach that requires the surgeon and the neurologist and the neuroradiologist and all of those people together in order to bring their expertise to bear on the problem. And in that way, that's how you dedicate resources to improving the outcomes of these kids.
For the past 25 years, Phoenix Children's Hospital has treated patients in the disciplines of neurology, neurosurgery, psychiatry, and psychology. Today, under the leadership of Medical Director Dr. P. David Adelson, the Children's Neuroscience Institute has come together and expanded into a seamless collaboration that includes neuro-oncology, neuroradiology, neuro-NICU, neurotrauma, neurocritical care, a comprehensive epilepsy program, and is home to the largest group of pediatric neurologists in the state.
The Phoenix Children's Neuroscience Institute has been around for a number of years, and it was based on a very traditional model. Our plan is to really expand the scope of that, to be able to encompass not just patient care and quality, but to improve things like research, and that would include clinical research, laboratory research, and translational research, and then also be a leading center for education of neurological disorders for kids.
The vision of the CNI is to be recognized as the center of excellence for the neurosciences locally, regionally, and nationally by providing the highest in quality clinical care as well as engaging and leading clinical research.
The mission of the Phoenix Children's Neuroscience Institute is to bring the highest in patient care, and that includes quality. But to get to quality, you need state-of-the-art research. And the third part of that is education. We need to educate physicians, nurses, allied health workers, and the families, and that is going to bring the best quality to these kids.
Dr. Jeffrey Buckhalter, a pediatric epileptologist, previously with the Mayo Clinic in Rochester, has launched the comprehensive pediatric epilepsy program within the hospital's Children's Neuroscience Institute. Dr. Buckhalter has brought in top talent, uses new technology, and customizes patient plans based on the latest developments in treatment.
One component of a comprehensive program is an epilepsy monitoring unit, and that can help us guide therapy, whether it be to medications, ketogenic diet, vagus nerve stimulator, or epilepsy surgery, all of which we have in our program.
While Phoenix Children's Hospital has been treating epilepsy patients for some time, the program has expanded to include a dedicated nursing staff specially trained in pediatric epilepsy, as well as the Pediatric Epilepsy Monitoring Unit, which is designed to allow specialists to capture data on a seizure as it happens in order to analyze the cause and determine the right course of treatment for each epilepsy patient.
The monitoring unit determines the nature of the events, whether they're seizures or not, how frequently they're occurring, and the precise location in the brain where they start. The latter is particularly important for epilepsy surgery.
Courtney was a typical high school student involved in cheerleading, dancing. She started having horrible seizures, and we came to Phoenix Children's Hospital. And we've been blessed that the Neuroscience Institute here at Phoenix Children's Hospital has been here for us in every aspect. They cater to the children, and it's really a blessing.
This is the MRI of a little girl who was born with a structural brain abnormality causing her seizures. As you can see here, a portion of her brain is missing, But the part of the brain that's causing the seizures is all of this abnormal brain around it, particularly down here in this very small temporal lobe.
Innovations like CoolCap therapy are providing newborns deprived of oxygen at birth with a chance to develop normally. The device includes a helmet-like shell that is placed over the baby's head and tubes that circulate cold water through the cap for a cooling effect.
We are able to provide this as the second neuro-NICU in the country, as one of our fundamental new technologies that we use for neurologically affected neonates.
Dr. Cristina Carballo says that before the CoolCap technology, there wasn't much hope for newborns who suffered a lack of oxygen before or during birth.
Neurologically, he would probably have significant long-term sequelae. I couldn't tell you exactly what it is, but probably from the range of significant cerebral palsy all the way to severe mental retardation. Whereas with the CoolCap, we are able to move in the other direction. Maybe there will be some developmental delays, maybe there will be some long-term, but they will be not as significant or severe. And with therapies, both physical, occupational, as well as learning therapies, we should have a close to normal outcome.
Specialized medical equipment, pediatric patient rooms, and pediatric specialists, in addition to the hospital's family-centered focus, make the Children's Neuroscience Institute uniquely qualified to treat pediatric patients.
My daughter, Carrie, was diagnosed with a schwannoma nerve tumor, which is very rare. In Columbus, Ohio, our doctor recommended that we come here to see Dr. Adelson at Phoenix Children's Hospital because of their expertise in this area. And surgery turned out wonderful. The tumor is gone and she has full function of her arm. We're very happy with our treatment here.
Real hard. All right, great. The future for the Phoenix Children's Neuroscience Institute is something that's going to be just absolutely grand. It's something that I'm here for, and that's why I came. You've got a supportive hospital administration, you've got a supportive medical staff, a growing facility. All of those things are going to be part of the critical mass necessary to make this an absolute success.
The Children's Neuroscience Institute is improving the quality of life for children with neurological disorders and providing comprehensive, high-quality, family-centered care, state-of-the-art research, and professional and community education. To learn more about the Children's Neuroscience Institute at Phoenix Children's Hospital, visit phoenixchildrens.com/CNI.